I was born in St. Louis, Missouri in 1990. My family life and early upbringing were fantastic. I had two amazing, loving parents that looked out for me. I had a great life, amazing life, for real. From any outside perspective looking in, it's like this kid is good,
Yeah.
like getting it. But in reality, I think it was the underlining mental health situation going on that led me to feel isolated when I wasn't, that led me to feel like misunderstood, that led me to like seek out, like we're not going to live, you, me, whoever is not going to live in either like physical or emotional pain for extended periods of time.
True.
Like I will find a solution. And unfortunately, the solution I found was not a healthy one,
Right.
even though at the time it was effective. I tried numerous times, just on my own, not even really knowing what like substance use treatment
Right.
or like social support groups were. That was unsuccessful. I went to treatment in 2013 at Centerpoint Hospital, where I went in, did detox, met with a provider, and was like, here's your solution. I was written a prescription for Suboxone, stayed for 21 days. Here you go. This is the solution to opioid addiction. So, got on Suboxone, worked for a few months until I began seeking out drugs again. I had a significantly large Suboxone prescription. I went and saw a different physician and got a Xanax prescription. I sought out recreational drugs like cocaine, alcohol, etc. And the only thing I wasn't doing was using illicit opioids. I would say the biggest difference between last time and this time would be, one, I utilized the Vivitrol shot for years. Two, I was plugged in at Recovery House in St. Louis, which provided not only a healthy social support network, provided a level of accountability that I had never had before, and three, it was just a place where sobriety was modeled in a way that for the first time it appeared attractive to me, right? Like I saw people that were my age, that were doing well, that were happy, that were genuinely successful in sobriety, and I had never seen something like that at treatment centers I'd been at. I had never seen it in outside meetings that I had been at. It was the first time that I was like, wow, like they actually seem genuinely happy, like they're being successful in sobriety. And like once it was modeled in a way that was attractive to me, I began to pursue it. In the early stages of recovery, I would say the most influential person on me was John. John just has a demeanor about him that draws people in, and it wants you to. John talks a lot about pulling the best version of other people out and having those people pull the best version of him out. And especially at that point in time, I did not know many, if any, people like that. You know what I mean? It was, in addiction, it was always a mindset of like, what can I get from someone? And if you get something from someone, there's strings attached, you know? So it was a new introduction with John and the guys at Recovery House that were like, bro, like, I'm just trying to help you. You know what I mean? And when I was introduced to that, and I was like, whether it be like John or Dave or whoever, and I was like, bro, I can't pay you back for this shit. They were like, bro, I'm fucking good. I don't need nothing. Pass it on to the next guy. That moment changed my life. That moment right there definitely had a profound impact on the way I began to view recovery and the way I began to view a way in which I wanted to live. There are a significant number of successful people in my family and extended family and family friends, right? Mm-hmm. And so I always viewed success equal to money, right? And so my primary goal with whatever it is in life is to, if I'm attempting to get an education, it's to get money. Mm-hmm. If I'm attempting to create relationships, it's to get money. If I'm attempting to develop whatever, you know what I mean? Like, mm-hmm. I conflated money with happiness, and I conflated money with success. And so the most significant mindset change that has happened to me in recovery and in life was beginning to identify the fact that, you know, money comes and goes, you know, we all know that, but, you know, what I'm seeking out in life is to have a purpose-driven life, is to feel fulfillment in the relationships I have, to feel fulfillment in the job that I work, and to be able to, like, when you help another person with no strings attached, like, it's priceless, you know, and it's a way in which it's the thing that has brought me happiness, I think, for the first time in, like, a genuine way. And so whatever happens, that is my focus in life, and that is what I'm here to do. ARCA and Archway built me up, motivated me, taught me a lot about what recovery looks like. As I got introduced to the field, I learned navigating the field. I learned a lot about access to resources. And I learned how to kind of connect the dots that were not being connected effectively, right? So you have treatment providers, you have housing agencies, you have medication providers, and without the proper connections or without the proper resources, like, people are not getting it. Mm-hmm. People are not getting plugged into the resources that they need. That is why Archway is so special, is because it identifies needs and actually has the ability to connect people to what it is that they need, right? Mm-hmm. So I was super fortunate when I was in the hospital to have, like, a mother and an aunt who were willing to look out for me. Mm-hmm. But guess what? If they hadn't found the treatment provider and they didn't have $500 to get me in the door, you know what I mean? Like, a lot of times the difference between recovery and death is seriously like $500. Yep. You know what I mean? And so learning first how to identify what the needs are, learning second what resources are available, and 3, how to actually execute the plan. There is, like, people in the field all the time talk about, like, burnout, right? Mm-hmm. Being, like, overextended. Like, I don't know what that is. I have no idea what you're talking about. For real. You know what I mean? Like, being at Recovery House, being with the Epic Outreach Project, like, doing these things, being with Archway, working with NCADA, like, all of these things continue to motivate me, and it's like a snowballing effect. Like, the faster I go, the more the snowball picks up speed of, like, motivation, energy, willingness, ability. Like, it all just stacks on top of each other continuously. I cannot tell you how many times between, whether it be doing Epic, Recovery House, or Archway, but it's like this overwhelming feeling that I am, like, exactly where I'm supposed to be. And it's like, it's not like a thought, it's like, and it's like I know. Like a state of being. I know that this is where I'm supposed to be and what I'm supposed to be doing. And we will continue to grow, we will continue to work, and we will achieve the mission statements that we have set out to achieve.